Good evening, everybody. I'm your host, Nikki Barron, and my co-host, Omari Salisbury, is out tonight. So I am flying solo here, my first coronavirus update show all by myself. So I'm excited and a little nervous, and I appreciate you guys tuning in. Today we're going to be talking about the vaccine rollout, things that are changing here in Washington State, and I'm going to go over the process of getting signed up and knowing whether or not you are ready for the vaccine. So if you have questions about the vaccine, go ahead and drop those there in the comments, and let's see if I can get to a couple of those at the end. But like always, let's start with our numbers. Okay, so today I'm bringing up this brand new dashboard that just got launched. It's got some updates here for you. And the numbers are, so we had another 2,041 coronavirus cases reported to Washington State, bringing the total number of diagnosed to 294,017. Due to a processing issue, the state did not report new deaths today, but as of Tuesday, we were at 3,940. So the newest thing you're going to see here as far as numbers go is they are now showing how many doses of the vaccine are given right here on our dashboard. So we are at 335,836 doses of the vaccine. So yeah, pretty nice little look here. They updated the colors and kind of gave it a little refresh. So as somebody who looks at this dashboard every single day, it's kind of a nice little change that we've got here. All right. Let's see if we have any comments here. Good evening, Keith. Hi, Dora. Thanks for tuning in, everybody. Appreciate you being here. Yeah, so vaccines. What's going on with all of this? Let's talk about it. Let's get into it. So on Monday, Governor Jay Inslee announced his new public-private partnership called the Washington State Vaccine Command and Coordination Center, which has a goal of administering about 45,000 vaccines a day. So for reference, that's about 3 times the rate that we're vaccinating right now. And it would mean that we would need to be receiving more vaccinations per week than we're currently getting from the federal government, which is about 100,000 doses a week. And in order for us to get to herd immunity in Washington, we need to get to above 70% vaccination. And so in order to do that, even if we're hitting that really lofty goal of 45,000 vaccines in a single day, it's still going to take us over 7 months to actually get through everybody to get us to that 70% herd immunity, which is pretty wild. But yeah, so right now, as of Monday, 1.5 million Washingtonians are now eligible to be vaccinated. And I brought the chart up here. So this is the criteria for phase 1B, tier 1. So that includes patients that are eligible. It includes individuals who are over 65 years of age, individuals who are 50 years and older that live in a multi-generational home. So what that means is people who are 50 and older and are not able to live independently, who either are receiving long-term care from a paid or unpaid caregiver, or are living with someone who works outside of the home. People who are 50 and older and are living with and caring for a grandchild, niece, or nephew. No individuals under 50 are eligible, and no individuals under 50 and older caring for a partner, friend, or child, unless that child is defined as above, is eligible. Also, if you are a member of the previous phase 1A, which includes high-risk healthcare workers, first responders and staff, and residents of long-term care facilities, you are also still eligible to get your vaccine. So remember when I mentioned that there's this new private partnership that's supposed to be rolling out that's supposed to help us get to that daily goal of 45,000 vaccines? Well, I went ahead and pulled up the list of everybody who's participating, and I wanted to talk a little bit about how everybody in this group is going to be contributing to vaccination efforts here in Washington State. So we've got first Kaiser Permanente. So their expertise is in planning for mass vaccination clinics and the distribution of vaccines to healthcare providers throughout the state. Starbucks is responsible for operational efficiency, scalable modeling, and human-centered design expertise and support. Microsoft is lending technology expertise and support. Costco is working with vaccination deliveries to pharmacies. And we also have some labor unions here. They're going to be working on coordinating volunteer vaccinators to locations where they're most needed, staffing and training, as well as safety and health consultations for the providers. And we're also going to see help from CMAR to help us make sure that we are hitting those historically underserved communities, and the National Guard to help with logistics and infrastructure support. Let's see here. So I have to switch back and forth by myself now since Omari's not here. Usually we help each other out when one's hosting and one's pushing the slides and things. So let me check the comments real quick. So Leon Bernstein says, don't know if you know this. If other states or countries are way behind in vaccinations, will Washington be at 70% really be effective? You know, I'm not a scientist, so I can't say whether or not it'll be effective. But if people are adhering to the travel restrictions that are part of Washington State's safety precautions, then in theory, yes. So it's really going to matter a lot on whether or not people are taking that seriously. I know that some other states like Hawaii are actually, they have an app that you have to use and they track it, and people have actually been removed from the state. They've been fined, things like that. So we don't have a process like that in Washington State. So it's really going to be based on people following the rules. So yeah, even after we are at that 7 months, and if we do get to that 70%, we really can't stop people from traveling into Washington State. We just have to hope that they're going to stick to those travel advisories that are being handed down by the governor. So jumping right back into it, since we talked a little bit about how we're going to be increasing the vaccinations, our goals for this vaccination program, and who is currently valid, I wanted to talk a little bit about the process of getting registered so that you can get the vaccine. So I put together a little step-by-step, and I kind of wanted to run through this with you guys. So if you think you're eligible, or you go and you find out you're eligible, you want to start by going to findyourphasewa.org and registering. When you register, it'll give you a confirmation that you need to print or screenshot on your phone, save the email, because you're going to need that in order to get the vaccine. The next thing you want to do is head over to the Department of Health's website to find a vaccination site. And it's important to remember that this list is always changing as we get new sites amped up, and as we have sites that get moved around based on need, that list is also going to be changing. And if you do find a vaccination site near you in your county is how it's sorted, you're going to want to see to the right-hand side on the column, it tells you exactly how you're supposed to register to get your vaccination appointment. You could also check each health system's website to see how they want you to schedule an appointment. So I know that UW Medicine just announced that they're administering the vaccination. And so you can actually go to their website and schedule an appointment directly through them. Step 3 is be patient. I think this really hasn't been hit in the news too much, but when you make a vaccination appointment, there's no guarantee that you're actually going to get vaccinated at that point, because we already have too many vaccines and not enough people to administer the vaccine. So right now we're only at about 43% of the vaccines that we currently have in stock have actually been administered due to that reason, because we just don't have enough people trained up. And that's not really the fault of Washington State. A lot of, maybe you didn't realize, but we didn't have any federal funding in place to help us actually train and expand that program until recently, when they passed the most recent coronavirus relief bill. So the money has been allocated now and is getting spent trying to ramp that up, but it's a really complicated system that we can't just turn on like a light switch. It's going to take a little while for us to get that kind of ramped up. So be patient, make sure you put it in your calendar, don't be a no-show. We are seeing a good percentage of people who just don't show up for the vaccine for their appointment. So you want to make sure you put that in your calendar, you don't no-show. And you might find that you made a vaccination appointment and then it got canceled. And the reason that that's happening is because we are scheduling appointments even though we don't have the resources to administer them or enough vaccines for everybody. And that's a way to kind of keep the line tight when it comes to getting the vaccine. So this might happen to you. It's really unfortunate. I recommend that you call the office where you had your vaccination and let and try to get back in line. They might be able to prioritize you back into a no-show spot or have you come and wait. So you just need to get back in touch with them and see if you can get back on that list. So it's kind of a clunky system at this point, but let's be kind to our healthcare workers, be kind to the administration staff that is taking your phone calls. They are just as scared and want to be able to get their vaccine and give you the vaccine. But it's a hugely complicated system that we just need time and organizational resources, and it's starting to come together. But if, we just need to make sure that we're being patient with those healthcare workers. So I'm going to check these comments again, see if anybody's got any more questions. All right. So Mary Lyons asked, are there timeframes for next level of people who are eligible for the vaccine? There actually are. So they're looking for the next tier to begin at the end of February. So if we were able to hit that 45,000 vaccinations each day, it would take 33 days to get through the 1.5 billion people who are currently eligible. We don't have that many vaccines. So we have to sort of hope and pray that the federal government is going to increase the amount of doses that we are getting each week so that we can hit that. But we can, I would say you can expect for the next tier of 1B to be eligible end of February, early March, because it's going to take, probably, 33 to 45 days for us to get through that first group if everything goes as planned. And we all know that big systems, not everything always goes as planned. So, all right, let me check these comments again here. Okay. All right. Well, that's really all I've got in terms of the vaccine. The only other news that I found today was, there have been some small hesitations about new variants and how the vaccine works with them. They're still going to work to give you protection, but they're seeing that these new, more viral variants may be a little less affected by the vaccine. And so that's really normal. As you know, with the flu shot, every year they release a different formula, and they do that based on predictions on how they believe different strains will spread through community. And I could definitely see that being something that happens with the coronavirus as we get booster shots, or even a yearly shot, just like the flu. We also go get our coronavirus shot. That formula will have to change to accommodate the changes in the virus as it mutates. But from what I can tell, they're not super alarmed. They're not like, oh no, this isn't going to work anymore. But they are saying that we're already starting to see the same patterns that we see in the flu, where we're going to have to start making, kind of a little pivots in that vaccination formula to make sure that we are staying on top of the most viral versions of the coronavirus. All right. Okay. So Leon asked, do you think masks might become a more permanent type thing? Honestly, yes. I mean, if we want to have any form of normalcy, we're going to need to be less than 2% in positivity rates for the coronavirus. And even at 4%, which we are currently at 10%. Yesterday we were at 17. So even at 4%, they're still recommending masks whenever we're in public. So I could definitely see masks being a part of our lives, at least for the next year, until we get a herd immunity globally, which is going to take quite a bit of time. But yeah, masks are still going to be a part of our lives. So yeah. Carolyn said, I'm going to start wearing masks for cold and flu season. Me too. I talked to my roommate about this. We've actually invested in learning how to make masks and, getting cool fabrics and really making them part of our outfits. And, it's kind of nice, especially in the cold here in Washington. It keeps you a lot warmer to wear a mask on your face. And yeah, I actually haven't gotten a cold or gotten sick at all this year. This is the longest I've ever gone without getting sick. And I know it's because I've increased my hand washing, my social distancing, and then, yeah, wearing a mask. So I think that masks will be a part of my life going forward as well. All right, guys. Well, that's all I've got for you. Don't forget to tune in to the morning update show at 11 a.m. We've got a guest host tomorrow. Omari is out again tomorrow. I believe it is Justin Carter of the Capitol Hill Seattle blog. So tune in. I'll give you guys another numbers update at that point. And yeah, I'll catch you again on Monday for the coronavirus update. Catch you guys later.